Hello, good day. My name is Melinda Frost and I work for the World Health Organization. Welcome to today's webinar. This is a joint production between the WHO Infodemics Management Pillar. It's an EPI-WIN webinar that we do in conjunction with the Collective Service. And the Collective Service is a collaboration between the WHO, UNICEF, International Federation of the Red Cross, and with support from the Global Outbreak Alert and Response Network. This collaborative service, the Collective Service, helps support risk communication and community engagement activities globally. Today's program is called 10 Steps to Community Readiness, what countries should do to prepare communities for a COVID-19 vaccine, treatment, or new test. This webinar is going to explore 10 well-established risk communication and community engagement principles that have proven their power over time. Practical tools for each of the 10 steps will be shared to aid in the uptake of these proven practices. Together, they're going to put communities at the heart of the rollout of new vaccines, treatments, and tests and promote trust, the critical ingredient for all community action. So thank you. With that, I'd like to let you know that there is some interpretation today. So you'll see it at the bottom of your screen. If you'd like some French interpretation, you'll see a small globe. Please choose that. Also, if you have any questions during the webinar, please enter them in the Q&A function at the bottom of your screen. We're going to go through the toolkit and some of the tools that are associated with each of the 10 steps, and then we'll turn it over to some question and answer time so you can talk to each of our presenters. So with this, I'm going to introduce the three presenters for today. Tom Moran, who represents the World Health Organization, Carla Daher, who represents UNICEF, and Alexander Chakot-Levesque, who represents International Federation of the Red Cross. Tom, Carla, and Alex will be presenting each of the 10 steps, and then with those 10 steps, some different tools that can be used to actualize these steps. So thank you. With that, I'm going to turn it over to Tom.
Thanks, Mindy, and good afternoon, good morning, everyone, and thank you for joining us today for this webinar and joint discussion. It's a pleasure to introduce, along with my colleagues, Carla Daher from UNICEF and Alex Chakot-Levesque from the IFRC, the 10 steps to community readiness, what countries should do to prepare communities for a COVID-19 vaccine, treatment, or new test. This is a new communication tool and concept we hope will help countries adequately prepare communities for the arrival of these new biomedical tools. I'm sure many of you on the call are aware that since April 2020, the Accelerator Partnership, launched by WHO and partners, has supported one of the most coordinated and successful global efforts in history to develop tools to fight a singular disease. And we are already seeing the results of this partnership with the arrival these months of new vaccines, the ongoing testing and clinical trials of promising therapeutics, and the delivery of millions of COVID-19 rapid tests, specifically for low and middle income countries. And the 10 steps are very much positioned to support this work, recognizing, of course, that widespread community participation and empowerment is actually critical for the successful introduction of these tools. The steps, through their focus on building and maintaining trust between health systems and people, also support the continued practice of protective behaviours and the adherence to the public health and social measures, which remain the most powerful means to stop the spread of the virus until these tools become more widely available. So as Mindy said, my name is Thomas Moran and I work here at WHO headquarters in Geneva. I'm a risk communication community engagement focal point for the Collective Service, which is a new partnership or a new initiative between WHO, UNICEF and IFRC to strengthen the coordination of risk comms community engagement, as well as the quality of practice, not just for the COVID-19 pandemic response, but potentially for future epidemic and complex humanitarian responses as well. For those interested in learning more about the Collective Service, a web link will be provided at the end of this slide deck, which will provide additional information. On a practical note, as we move through the steps, I encourage you to think through what steps may be already incorporated into your programs, or where steps you may not have thought about or fully realized can be better implemented into your programs. I'm sure there's many people on this call that are working on the front lines of the pandemic response, and I do hope that these principles and the steps really challenge you in your work as you look to update and revise your strategies for 2021. So next slide, please. So before getting into the steps themselves, I think it's worthwhile to provide a little bit of context and a little bit of background to their development. The purpose or aim of these steps is actually quite simple and comes from specific requests from focal points and countries for more practical and operational tools that help shift strategies to be more people-centered and community-led. The call coming for more inclusive engagement strategies, coming from the joint COVID-19 RISCOM's community engagement strategy published in December. This is a joint strategy. I hope people on the call have seen it. We can provide the link to the strategy in the chat through the call. The steps are very much grounded in available evidence from previous outbreaks that have taught us that without informed, engaged, and empowered communities as the bedrock for health and emergency programming, these programs run real risks of being ineffective or even completely rejected by the communities or programs they aim to serve or partner with. The Ebola outbreaks of 2014 and 2015 in West Africa spring to mind, as well as more recent Ebola outbreaks in the DRC, where communities actively rejected a new vaccine because inadequate or ineffective community engagement efforts were made, with inadequate efforts to really involve communities in the planning for the rollout of that vaccine. Having worked for the Global Polio Eradication Initiative for many years, I've repeatedly seen the importance of local community action in ensuring the uptake of polio vaccines in a number of countries as diverse as Indonesia, Nigeria, the Ukraine, India, and the Philippines. One of the most important aspects of the steps, I guess, is to make them as concrete and actionable as possible, and ensuring that people understand that the empowerment of people and communities is not an abstract idea. Though communication needs may be slightly different for each tool or for different programs, the principles that promote safe and successful introduction of tools such as these remain the same. These same proven principles also promote trust, social cohesion, and principles of fairness, which we know are so important for all community action. So next slide. So why are these steps important now? Well, there's a number of reasons. The most obvious being that the new biomedical tools, especially COVID-19 vaccines, are now either available or will become available in many countries or most countries in the next 6 months. For example, the COVAX facility responsible for the global procurement of COVID-19 vaccines has secured access to almost 2 billion doses of the of different COVID-19 vaccines, and which will be on their way to countries, particularly low and middle income countries, in the next months. Many countries have not yet updated their risk communication plans to be ready for these new tools. For those who have been working through the pandemic, of course, you would already know that the communication landscape is confusing. Along with the pandemic, we have seen an infodemic defined by WHO as the overabundance of information, including misinformation and rumors, which makes it hard for people to know where to go and who to trust for information. And we've seen the damaging consequences of this infodemic right through 2020 and into 2021, particularly as the new tools begin to come online. Coordination with countries as well has been complex and sometimes difficult, coordinating through the myriad of global and regional working groups, which are fragmented and confusing for those working at a country level. Many of these partnerships and stakeholders have different communication needs and priorities, and a goal of the steps is to make sure that we provide a one-stop shop, I guess, for those working on the front line, so they know where to go to get the guidance, regardless of whatever biomedical tool they are looking to roll out within their country. I think we also have to acknowledge that people have perfectly rational concerns over the safety of vaccines and other biomedical tools, many of which have been made with unprecedented speed and with new technology, specifically the mRNA vaccines, for example, that are coming online. And I think it's really important that we create space to address some of these concerns that are valid and real. I think anyone who has worked in the risk comms community engagement space knows that investments in the community engagement and empowerment strategies are not yet sufficient or haven't always been adequate for the equitable rollout and maintenance of trust in all settings and in all countries. Finally, I think just one final point here, as pandemic complexities grow and pandemic fatigue increases, it is critical we provide more individual and nuanced response measures. As we have learned during other epidemics, coordinated, adaptive, innovative, and localized approaches will be crucial in controlling COVID-19 throughout 2021. So next slide. So what is the data telling us? While this is just a snapshot of one particular data set, it comes from the Johns Hopkins University dashboard. It's a partnership between WHO, MIT, Johns Hopkins, and Facebook to poll more than 1.2 million people actually across 77 countries throughout 2020. It's one data point taken from this polling, and that is people's intent to be vaccinated against COVID-19. Although it is one data point, I think there's a couple of important takeaways for us. While most people report that they are willing to accept a COVID-19 vaccine if safe and effective, the latest data tells us this is approximately 65% of the global population. There are large hesitant populations in many countries, or a number of countries. For example, you can see on the map in Morocco, many countries of Western Europe, Ukraine, Indonesia, and the Philippines, for example. However, importantly, there's also a sizable portion in the middle who are undecided and can be motivated. And this is our opportunity. And this is the target and the people that we need to be focusing our strategies on. It is this cohort somewhere on the spectrum of hesitancy between skepticism and actual acceptance, who can be informed of new science and information. They can be engaged to promote and become advocates for more effective strategies, and they can be truly empowered to make decisions with and on behalf of their communities. So what is at stake? Next slide. So the stakes are high, given ongoing transmission patterns, the subsequent or associated mortality, and the broader impacts on health systems and care. If trust in public health directives is lost, including a loss of trust in COVID-19 vaccines and potentially other vaccines, then many thousands of lives or many hundreds of thousands of lives will be lost. Specifically, the rollout of biomedical solutions will be ill-adapted to local contexts, realities, and daily lives. The uptake of new COVID-19 vaccines and or treatments and tests will be suboptimal or inequitable, and billions of dollars worth of investments in new biomedical tools could be wasted. Finally, the pandemic may continue with a precious opportunity to end or control it missed. So next slide, please. So over to the steps. This is the first glimpse for some of you of the steps. Thanks for your patience in allowing me to provide the context. We will go through the steps one by one and in more detail, but this slide shows the overview and the order of the steps we are about to run through. I won't read through all the steps here, as some will make more sense with the additional context and information in the following slides, but I think a couple of points to make here are important. The first is that we expect there will be some debate around the steps. Some of you may think that we've missed steps or that some of the steps are superfluous or redundant. And this is okay, and this is great and will feed into our discussions. The steps are not meant to represent a full set of guidelines or a full set of guidance for countries, but primarily act as an operational tool that help those on the front lines to operationalize their risk communication and broader COVID-19 strategies. Finally, I'll come back to this at the end of the presentation, but the steps are more of a concept than just a tool, and I'd like people to think about them in that way rather than just a slide deck, for example. And there are some exciting ideas on how we plan to use this concept to link country and regional focal points more effectively to the guidance and tools they need. And we'll go into this in the next step slides at the end of this presentation. So thanks so much for the opportunity to present the 10 steps. I hope the principles within them are useful for your work. And I'd like to just hand over now to Carla and Alex, who will both take you through the steps in the next slides.
Thank you so much, Tom. Good morning, good afternoon, good evening, everyone. This is Carla Daher. I am an RCCE specialist and I work with our UNICEF office, emergency office based in Geneva. So I'm going to present to you the first 5 steps, and then my colleague Alex will take over the next 5. So as you can see on the screen, step 1 is about really reminding countries that making decisions about the people with the people is key to success. What this entails is that if people are more likely to take action if they're involved in decision making. So engaging communities early on and collaborating with communities and empowering them is key to success. Leaving no one behind is also a key component, meaning really thinking of how to bring in the most marginalized communities, the migrants, the refugees, the people who do not have access to information, the people who most likely have the biggest levels of skepticism or doubt, as my colleague has put it in previous slides. So this is what it is. So basically identifying which communities we want to work with and then identifying the right communication channels for each, because we cannot take communities as a whole, as a homogeneous. Any country is not made of one big homogeneous community, but rather smaller communities that all have their sociocultural context and power dynamics. And therefore, initiating discussions with the communities to understand these sociocultural contexts and power dynamics that could influence the way they behave, if they take the vaccine, if they demand the other biomedical tools is quite important. Once we understand how these dynamics work, then we can build on them, engage them, and tailor our strategies to those contexts in order to make them more successful. So mapping those communities, the networks, and the right influencers that really have impact on how communities behave is key in this first steps. And then once those communities are identified, identifying what type of engagement interventions are safe, feasible, and acceptable should be the next step. In some countries, for example, community radio programming is one of the most effective ways. Social media for high literacy context, loudspeakers and megaphones in countries or contexts with refugees or low literacy rates, etc. So it depends on the context. If you want to know more on how to do this, there are a set of resources that you can go to, and Tom will go through them with you quickly at the end of this webinar. But for example, on top of my head is the Community Action Guide by the IFRC on vaccines. In particular, there's a resource that is great from WHO called Conducting Community Engagement for COVID-19 Vaccines and Interim Guidance. And there's a lot on tips for engaging communities during COVID in low resource and low connectivity settings. So all of these are just part of the wide range of resources that we put at your disposal from a wide range of partners for your reference. Next slide, please. Step 2 is about building trust. First, we understood which communities we're dealing with, the sociocultural context, the power dynamics, who influences who in the community. And then once we identified these people and decided to work with them, we want to now create, an entourage or a milieu of trust, where trust resides. So maintaining and strengthening trust is this next step. Through formal and informal connections. And that is by coordinating action through the widest set of stakeholders possible. A whole of society approach works best in this case. So trust brings communities together for action and is paramount for creating demand for biomedical tools, including now for the vaccine introduction. How do we do this? Mainly by activating wherever it is not active or strengthening wherever it exists, the RCCE National Coordination System, right? So whatever this system exists, we need to make sure to strengthen that system, use existing health and response structures as well to support the health system readiness at all levels. Making sure to have the right civil society organizations that bring the voice of people on board is also quite important, because we need to be as inclusive as possible if we want to be successful in creating and maintaining trust. Working closely with committees and advisory groups such as the National Immunization Advisory Group could also be extremely helpful. And in this creating trust environment, we always also say creating and strengthening independent national alliances is very important. And it's really the next step after step one, where I said we identify our communities, the power dynamics, who has influence on who. And then if we discover that some doctors, healthcare providers, I don't know, community leaders, faith leaders are the most trusted sources of information, that this is where we need to bring all those influencers on board in a national alliance that is joined to the RCC coordination mechanism, and that really through which we can build and maintain trust. I want to spend 10 more seconds on it, just to say that the strategies for creating trust are all about really accountability, bringing competence on board, transparency, being honest in the strategies that authorities and the national government is following, the messages, the RISCOM messages. They need to be empathetic, yes, but also honest and evidence-based, based on science, explaining how and why the government is acting as it's acting, and including equitable resource distribution, all of which you can find in many of our also set of resources that my colleagues will be sharing with you at the end of this webinar. Next slide, please. Listen more, talk less. Right? We always say this is extremely important. When we listen to people more and we listen to their feedback and regularly seek their feedback and make sure we put together and make available community feedback mechanisms, this is where people start to feel that first they're more engaged, and then they have more influence on the way the response is taking place, and third, that the authorities and the public health system is taking them seriously, and therefore trust will automatically be improved. And so regularly seek out and respond to feedback from communities is what this step is all about. This improves the relationship and trust between communities and their public health authorities. The way you can do this, or countries can do this, is by establishing community feedback mechanisms to promote accountability and ensure that community beliefs, questions, concerns, and suggestions are all heard, and guide the continuous adaptation of the response based on this community feedback. So it's not only about really making sure people have opportunities to ask questions or share their opinions, but it's also how do we use whatever people are saying and bring the voice of the people in the way we make course correction to our response immediately, not at the end. For this, we have a great package that the IFRC has put together on a community feedback. So you can also refer to that. The link is also in the mapping of resources that we've made available. And there's also a community needs, perceptions, and demand community assessment tool by WHO that you can look at, as well as the accountability to affected populations handbook made by UNICEF that you can all look at to see and read more about how do we establish community feedback mechanisms. Next slide, please. Slide 4 is about using this community feedback. As I said, the community feedback data should be informing decision-making, but it's not only community feedback data. It's actually a triangulation of social data as a whole, right? So using data for decision-making and course correction is key, but goes a little bit beyond feedback data to include other types and sets of social data, because this social data gives an important perspective on what the communities know. Do they know that the vaccines are there? Do they know what is the government strategy in making sure in distributing those vaccines? Who are the communities that will first be vaccinated? Do they agree? Do they have a gap in knowledge? What is their attitude if this vaccine is made available to them, or other biomedical tools? What is their attitudes toward these biomedical tools? Will they actually seek to get them? Will they use them? What is the behavior that they're going to do? All of these things, as the behaviors, the drivers and the enablers and the barriers to taking this sort of action that we want them to take is paramount, and understanding these drivers and barriers is also important to shape our strategies. For something as complex as human behavior, a mix of data sources is best. And this is, as I said, including community feedback, social listening, polling, survey data to best understand community knowledge gaps, perceptions, and behavior, and making sure everything that you get, the analysis that you get, is not only informing risk communication and community engagement plans in countries, but other pillars of the response as well. If the people are talking about the lack of, I don't know, access to the vaccines in certain areas, and this has to do with the supply, this has to be brought to the supply pillar of the response. So I'm just giving examples on how not to keep it within our circles, but also to make sure to inform other pillars based on this social data. So here you have many, also resources that you can use to make sure that your country teams know how to implement the step. You have the Community Rapid Assessment Tool by UNICEF. You have Data for Action, Achieving Increased Uptake for COVID Vaccine by WHO. You have the RCCE Framework Core Indicators by IFRC, UNICEF, and WHO, and many others that I'm not going to mention right now, but you will have access to once you have the link to our webpage. Next slide, please. Final slide for me is the plan with the people, right? So this is different than step one, where we say also we need to listen to the people. Once we identify the communities and the channels and the influencers that we need to bring to our RCCE national coordination systems, now we need to give them a co-creation role and power. We cannot be one way. It cannot be a descriptive RCCE strategy. People need to be in every step of the design of how this response is made, right? Specifically the RCCE strategy that the public health authorities, or the vaccine introduction, the biomedical tools introduction that the public health authorities are going to be adopting. And so community participation in planning can improve services themselves because their views are taken up from the very beginning, ensure services are equitable, and help to remove barriers. This is especially important when introducing new tools, such as vaccines, treatments, or new type of tests. How do we do this? By ensuring communities are involved in co-designing solutions, as I said, using the social data analysis that we spoke about in the previous step to develop and regularly review and update the plans, and by developing crisis communication preparedness plans based as part of this process. And really all of this can be, you have one particular tool in this that you can actually look at to implement this step, that is called Acceptance and Demand for COVID-19 Vaccines by WHO and UNICEF. And it encompasses everything that you need to know to implement the steps, such as social data collection. How do we collect it? How do we use it? How do we strengthen coordination and planning? Implementation with the people, how do we bring in people to the monitoring plans, how do we manage misinformation, how do we conduct social media monitoring, how do we develop crisis communication plans, advocacy plans, etc. You have many more, but I'm just giving you a snapshot of some of the resources that you can find with regard to this step. So that's it for me. Now I give the floor to Alex, my colleague from IFRC, for the remaining 5 steps. Thank you.
Thanks, Carla. Just before we go to Alex, I just wanted to remind everybody, if you have some questions, go ahead and put them into the Q&A function at the bottom of your page. Thank you. Alex?
Thanks so much, Mindy. Thanks, Carla. So I'm going to be presenting the last few steps of the 10 steps. So step 6 really relates to what Carla just talked about around involving communities in planning. And this is about really involving communities in monitoring and evaluation, and not so much just about how do we ensure that the voices of communities are included in the evaluations that we do in our programs, but more how are they able to co-design and co-create together with us the monitoring and evaluation processes. And I think it's an interesting one because traditionally, most organizations, when they do conduct evaluations, are focused a bit too much on processes rather than actual impact. And for that reason, I think we still require a lot of a cultural shift in how we do monitoring and evaluation. And where we can really ensure that communities have a say on how the process should be conducted and who really we should be speaking with, who should be included throughout the process. And of course, as we mentioned earlier as well, communities are extremely diverse. So how do we ensure that all people within a community are really involved as well in the monitoring, evaluation, or the planning, as Carla mentioned before? So really reaching the last mile is when we do an evaluation, to ensure that it's really representative of the people we serve, and to ensure that our intervention really had impact. And that's, I think, particularly important when we talk about vaccination. In terms of resources for this step, I'll admit that we haven't collected yet so many examples or resources. So if any of you actually have resources that you'd like to share with the group, please do in the chat and later on as well, so we can include. For us at IFRC, we have worked with an application called Our Story. We worked very closely with the Indonesian Red Cross on this application to ensure that communities were able to do monitoring themselves through video, through this app on their phones, and that they were able to monitor different projects. And that's been an interesting program for us that hopefully we can learn from as we implement this. Next slide, please. Thank you. I might actually stop my video because my connection's a little bit wonky. So the next one is so important because obviously doing risk communication and community engagement really involves a lot of resources and time. And for that, it's really people. It's obviously sometimes an issue. It's difficult to make the case to hire more people in this type of work, or any type of work we're doing. But when it comes to community engagement, the expertise around community engagement and risk communication is so important. So really this step is around identifying as well, where are the gaps in terms of expertise, and identifying who has the expertise, who is best placed to fill those gaps in support of national authorities, and also around coordination. And coordination capacity is so central, as Carla mentioned as well in previous steps. So on this step specifically around resources, in the humanitarian sector, we have developed standard terms of reference, for instance, for more technical expertise and coordination expertise on community engagement. This is something we're working on as well, to develop standard types of terms of reference for different types of roles around risk communication and community engagement. So the collective service is working on this currently, and we'll be sharing that as well through our website. As well as it mentioned here on this step, it's also about ensuring that we have standing operating procedures for RCC embedded in those coordination systems, so that the staff who are responding are aware of what needs to be done and who should be doing what. And that's really as well quite central to ensuring that we have the right expertise and that we leveraged the right expertise at the right time as well. Next slide. So this one is really essentially around building capacity and making sure everyone has the necessary skills. And that's not only just for this current pandemic, but also for years to come. And so essentially this, of course, is around training, but I think we'd like to emphasize here that it's not just about delivering one-off trainings, but also ensuring that we train trainers, that there are peer-to-peer networks to support staff, but as well, ideally mentoring as well, that staff are accompanied in their work to ensure that they have the skills to really do proper risk communication and community engagement. In terms of resources for that, I think a lot of different organizations in the collective service and as well, and different partners across the globe have developed a lot of trainings. For us at IFRC, we have a training specifically for COVID-19 around risk communication and community engagement and e-learning. There is as well from the collective service a community guidance for social mobilizers, frontline workers, and volunteers. And so there's really a wealth of resources for people who want to increase their skills in this area and really build a capacity of different types of workers and frontline workers working on community engagement. Next slide. So this slide, I think all of us have heard, of course, about the infodemic. I think it's been almost a year now since WHO's executive director declared that we didn't only have a pandemic, but we were also facing an infodemic. And so what do we mean by infodemic? It's really about an overabundance of information, sometimes good or bad, but that it overwhelms people. And because of that, it's difficult to make decisions for their health and as well for their communities, because the information is confusing. So of course, when we're facing a new virus, as you all know, the plethora of information from left and right comes in, and it's also it fosters a ground for what you see on this slide, fake news, for instance, but for also misinformation. So I think it's also about ensuring that we understand how people access information, how people want to access information, but also understanding what sources of information they trust and those they don't trust, and how do we ensure that people receive information in a way that makes sense to them, but also through channels that they trust, and not just relying, of course, on social media, but relying on different types of channels. So around this, it's really around also ensuring that we have fact-checking capacity at the national level, because this needs to be very context specific, of course, and also rumor monitoring capacity, realizing, of course, that rumors and misinformation can be as dangerous as COVID-19. In terms of resources for this, there's really been a wealth of information and resources from WHO, who's produced a lot of research around infodemics in the past year. There was also a training on that. UNICEF as well has done a misinformation guide. Internews has been publishing regularly rumor monitoring bulletins, and also has a number of resources around rumor management. So again, it's also about ensuring that this is done as locally as possible, because even if you look at the infodemic that might be happening at a national level, it might be very different at a sub-regional level and in different communities, even at that level as well. So it's so important to invest in how we're looking at infodemic as context specific as possible. Next slide. So this is the last slide, I think, that the last step that brings it all together. It's really ensuring that communities have information from locally trusted channels, as per the previous slide, as I explained, and that we do it together. And so that we involved everyone in the community in ensuring that people have the right information, are themselves our agent of communication, of change and community engagement within their communities. So of course, this is about, if we related to step 3, when Carla presented about the fact that it was so important to listen more and more and talk less. I think this goes for this slide as well. Of course, here we're talking about providing information to communities, but it's in providing information within communities. But it's important to remember as well that it's not so much just about kind of throwing top-down messages, but making sure that the information is adapted to the context, adapted to people's concerns and preoccupation and perception, and that it's also available in local languages and in a language that makes sense to them. So how do you really adapt, you know, sometimes confusing information, scientific information, in a way that is accessible to different types of people in the community? In terms of resources for this step, there's a wide range of resources, of course. We have some tips for using social media. We also have the community radio toolkit, which I think is really interesting, because it's still, we're a lot of times, because of the response of COVID-19, given social distancing and that we're all working virtually, there's been a lot of emphasis, of course, on social media. But I think in a lot of communities to this day, community radio is really essential in ensuring that two-way communication ensuring communities have information as well in an accessible way. So the Community Radio Toolkit, I think, is quite interesting for many of us. So this is the last step. And I think we have about 15 minutes for questions, and a little conversation. So I'll hand back over to Mindy.
Great, thanks so much. Thanks, Alex, and thanks, Carla. Thanks, Tom. Let's see, Tom, did you want to go to the toolkit online now and talk about that?
Yeah, we can just quickly, just to wrap up and let people know what we're thinking about with regards to next steps. So you can see here what is a screenshot of a website that will be live very soon, where available tools and guidance that help countries operationalize the steps will be made available. So I've just lost that slide, but I'm going to try and quickly link you to the actual site. Can everybody see my screen? You should be able to see a website with the toolkit and the 10 steps.
Yes,
Clearly
we can
marked.
see it.
Great. So look, unfortunately, the site is not live, but we promise to follow up very, very soon with all of you when we clear the steps needed to publish and go live with the site. But you can see the idea of moving beyond just a tool and a product that may help you at a country level build capacities or share the experiences and power of the principles with other stakeholders. But we hope to link you very quickly and very soon to a number of different resources that are becoming available through the different vertical pillars of the Accelerator Partnership. And we're mapping these tools to each of the steps. So we really hope that this helps focal points working at the country and also in the regional levels really operationalize these steps into the new strategies and plans that you will be updating as we move into 2021 and beyond. So you can see here, decision making together, just the first step. We have a number of tools here. I think Carla went through many of these tools when she presented the steps. We're also trying, these would be generally available tools under the broad banner of risk comms community engagement. But where we have the tools specific to the rollout of COVID-19 vaccines, we're also linking you specifically to those very specific tools. And we're doing that also for tools linked to treatments or new tests becoming available as well. So these are the very first, sort of conducted the first mapping exercise. And over the next days and weeks, we hope to really build out the number of tools and the quality of tools that will be available to you. So please, I think it's the opportunity to call out to you. If you do have a tool or a product that you think matches one of the steps and would help people operationalize the steps, please do send it to us through the contacts that you've been given, and we would look to map it as part of this resource. This will be part of a broader collective service website that we're looking to launch. That will be the one-stop shop for all things risk comms community engagement, a gathering of information, other knowledge hubs, latest social behavioral data, which we hope give you the edge in terms of ensuring that your strategies are evidence-based and incorporating the latest science and principles of behavior change. So we're pretty excited about the site. You can see here there's a number of pages. I won't go through them all now, but we promise to send the link as soon as it's live to those who are on the call. So that's it from me. Thanks, Mindy.
Great, Tom, thank you. I can see in the chat a number of people are really looking forward to that site. So again, as Tom just mentioned, we'll send you the site as soon as it's up and going. So we did, Tom, have a question in the Q&A function there. Is there a source that accompanies this guide regarding the vaccine schedule rollout? So essentially gives countries the ability to sort of match appropriate strategies and timing with their vaccine rollout process.
Yeah, I mean, that is quite difficult to give. What I can say is WHO is setting up a monitoring of vaccination introduction status with target populations and administered vaccination doses as a special module of the routine immunization monitoring system. The development of the reporting questions and frequency is ongoing with a view to start data collection in the first quarter of 2021, but I don't have that in front of me, and it's not publicly available. There are sites online. I think Bloomberg has a vaccine tracker, but this is not verified data or endorsed by WHO, but there are different sites where people can go to get different pieces of this information. It's very difficult to currently give a very accurate estimate of when some of the vaccines will arrive in country, because there's a lot of moving parts there, of course, with regards to production and shipping, national regulations, etc. But we know that there will be large movements of vaccine coming very soon to a large number of countries, with the commitments to move 1.8 billion doses of new vaccines by the end of 2021. Just an important point for people that currently it's estimated that around 6 million people a day are being vaccinated with the COVID-19 vaccine. And this is increasing every day, and we expect this number to increase as the new vaccines become more widely available.
Great. Okay. Thanks, Tom. I also want to let you know we're joined by another two colleagues, Noreen Nakvi from UNICEF and Umbretta Baggio from the Collective Service, to answer a few questions. So the next question is an individual that's curious to hear more about the community's monitoring program via their mobile phones and sharing content from that as well. Noreen, I think you're ideally placed to respond to this question.
Thanks, everyone. It's really a great chat going on and very interesting questions too. Just to let you know, like, we don't have the examples that are very specific to a particular topic that we are talking about, but then I would like to talk about the opportunities in this area, because we now have over 12 million U-reporters. The U-report is one of our digital tool. This is the tool through which we have engaged with young people. We have engaged with so many different people in the communities during different disease out in Africa, and now we are in many countries across the world. But this is one of the tools that we explored even further after the pandemic, and we learned a lot from it, because you all know that there is a limitation to how we could continue human interaction. So that was one thing, and we do have further examples of how we use this tool for different purposes. For example, to conduct rapid assessments, to get some the concerns of people, respond to some of the concerns, ask them questions to get the level of their knowledge. I will not go in the detail of that, but we would be sharing the details with you, Mindy, so you could share with all the participants, because that's very important. The other tools that we are using in this space is chatbot, which is also very popular also in European region and in so many other regions. There are good country examples too around that, and how different countries are using this for different community engagement efforts going on. Then we have Internet of Good Things. That is also one very cost-effective tool, and so many others. So I would like to say that please do go through all these tools and the possibilities, and also learn from different country experiences. Over.
Great. Thanks, Noreen. Thank you. So our next question is whether somebody can share experiences where tools were available, but people wouldn't use them either due to trust issues or other community engagement challenges. I think, Umbretta, you might have some experience around this from past Ebola outbreaks. Umbretta?
Hi, everybody. Thanks, Mindy. Thanks for the question. So we've seen over and over during the past Ebola outbreaks, especially the 10th one, how despite the fact that we had the most effective biomedical tools on the ground, from treatment to testing to vaccination, those tools, the uptake of those tools has been challenging, and we had all the data in our hands to understand what communities' concerns were there, what behaviors were challenging, and from the data up to the second year of the Ebola outbreak, we've seen that between 30 to 60% of the people would not go to a treatment center if they had a sign of Ebola, and they would not recommend this to their family members. And the other piece of data was also coming from the community feedback system that the coordination system on the ground was using. And from thousands of feedback, people were saying that they had challenges with vaccines, and vaccines beliefs, concerns, and feedback was the top category in terms of community concerns and feedback for over 2 years. This is just to illustrate that we need to understand those questions, beliefs, and understandings to really support the rolling out of tools. Availability doesn't mean acceptability, doesn't mean uptake. And what has come out really from the learnings has been, especially through the social science cell that UNICEF has supported in DRC, has been that we need to invest into community health workers and frontline workers' capacity to really engage the people in vaccines rolled out. This was a key feedback from the people, that they found health workers ill-prepared to share vaccines information with them. They said also to the people on the ground that there was no integration with the immunization system. So another key learning, that we need to make vaccination part of a system they understand and recognize. And the third one, a big concern around eligibility. There was amazing confusion for 2 years around who was eligible to get a vaccine. This is a very big learning that we need to take into consideration for the vaccines rollout in COVID. Over to you, Melinda.
Great, thanks so much, Ambrata. We have another really important question, and a lot of us remarked on how we continually get this question. In fact, I did a webinar even earlier today and got something similar. And it's from Fernanda Sanchez. What do you recommend if high leadership is not totally open to hear these steps, or for really involving communities, I think, in the response? Any thoughts for how to deal with these types of barriers? And maybe I'll go to Alex for that response, or Carla.
Yeah, thanks. I just shared a link in the chat. I think we could talk about that a lot, but I mean, from what we've heard before, I mean, in a lot of countries I visited, from leadership is really around wanting more evidence of why community engagement works, or it's worth investing in community engagement approaches, and basically in these 10 steps. And so the thing is that there is a lot of evidence, and I think Ambrata just talked about some in the Ebola response. So what we did is we actually did a piece of research, which I've shared in the chat, which is called All the Evidence We Need. And it's a series of different briefs, and showing the different evidence that we have that demonstrates why community engagement really has impact and improves the way we respond to a crisis, whether it be a humanitarian crisis or a health crisis. And what needs to be done for that. And there's even one brief specifically targeted at leadership called Changes in the Hands of Leaders, and why really it's about leadership championing community engagement and accountability if we are really going to make a difference and be effective and have impact in our work. So I won't go into too much detail, but there's a lot of info there on that. And Carla, maybe you want to add something.
Yeah, no, just to build on what you said, Alex, because that's basically it. But I think this is also all about advocacy, Melinda. So I think this is where the advocacy strategies should come in, right? We need to be able to work together with the government, and it's not all a one shot. It's not that we work with the government and the government is going to be convinced. From what we've seen is it's a give and take. And so in one of the resources that I mentioned on building trust that the IFRC and UNICEF have developed, there's a big component on how important advocacy is, and this give and take process, when they say no, and then you bring back some evidence that most of the communities are saying something that they need to take into account. Otherwise, they will be looking at, like, they will be seeming like they're failing, and governments do not want that. They want to have good reputations, even if they're not doing what the communities want. So I think this advocacy and bringing in evidence and the community feedback all come together to sort of work with governments that do not want to listen. And on advocacy, you can also find some of the resources. Sorry, I don't have it written in front of me, but I know because I've seen it in the morning when I took a look at the list of resources that we mapped out, that this exists in our list of resources for those who want to dig more into that. Over.
Great. Thanks so much, Carla. Also, as Tom mentioned earlier, a lot of you may have some other resources that might easily map to these different 10 steps. So if you have those resources, I would invite you, or if you have additional questions after this program, to please send your emails to epiwin@who.int. So that's EPI-WIN@WHO.int. So epi-win@who.int. I think one of my colleagues can possibly put that in the chat area. So if you have some other resources to offer, please let us know. I'm going to end with one more question, and that's from Joanne Doherty. What do you recommend as a primary tool to use for communities with low engagement? I'm just going to kind of open that up to everybody, and then I'll go back to Tom to close out the program for today. Any suggestions for that one tool for communities with low engagement?
What does low engagement mean? Is it people who do not want to engage, or I do not, can they clarify the question? Is it people who are not interested to engage? So how do we bring them on board and make their level of interest increase? Like, what if this is the question, then it's all that we've been talking about, right?
Yeah.
People who are not interested, Joanne is saying in the chat. So I don't know.
Yeah, I mean, we have tools on pandemic fatigue, right? It's been quite a discussion of the past months. So, I mean, I know at IFRC we developed a tool on that, which I'm happy to share. And I think in the collective service as well, we have different tools. I mean, there's one as well on, I think you mentioned it earlier, Carla, on community engagement in low resource settings, because sometimes maybe people are not engaging because they don't necessarily have access to the right channels. So it might not just be low interest, but I think on pandemic fatigue, I think it was WHO as well that had a really nice research I think it was in Eastern Europe, I forget. I think it was European on pandemic fatigue. It was super useful. And I would definitely look at that if you haven't.
Yeah. Great. Thanks, Alex. Thanks, Carla. Okay, with that, I'll thank everybody for your time today. It's always valuable to see so many responders join in. I know your time is valuable, so I hope this has been useful for you. I'm going to turn it over to my colleague, Tom, to close out the program for today.
Thanks, Mindy, and thanks, everyone. I've got very little to add, but just a thank you for those who have participated today. It's been an active discussion. We appreciate your feedback. We encourage you to continue the discussion and the conversation with us. If you do have materials and tools that you think are valuable to us, we'd be very happy to map them out and share on with those who are participating on this call. We hope you found the steps. We hope that they resonated with you, and we hope that they can help you operationalize your strategies, moving, of course, towards the people-centered and community-led approaches we know that are so important to close out this COVID-19 pandemic. It's going to be a tough 2021, but I think with these tools and with these principles, we can go a long way to ensure that communities are brought on board and become part of the solution, which we know they should be and can be. So thanks, everyone, and have a great week. We'll speak to you soon.
Thanks. Thanks, Tom. Thanks, Carla. Thanks, Alex, Umbretta, and Noreen. Thank you so much.
Thank you, everyone.
Thanks, everyone.